Hi, I'm Dr. Stephen Steep, and I want to welcome you to my office, the Oxford Veterinary Hospital. Well, we've got another exciting show for you today. We're going to talk about teeth. We're going to talk about teeth in dogs and cats. I don't know if you know this, but February is Dental Health Awareness Month. And we picked that month, veterinarians picked that month, because it's a time when things slow down a little bit and we can focus on something that takes a lot of time but is extremely important. Consider for a moment the mouth of a dog. How many teeth do they have compared to people? We know that their dentition is different. Dogs actually have 42 teeth. Normally, they may have more or less if there's a pathologic condition present, but those 42 teeth are subject to the same stressors and problems that our teeth are. They accumulate tartar, they get cavities, they chip, they break. So it's up to us to recognize those problems and to take care of them. We do this not so much for cosmetic reasons, but because good dental health leads to good health internally. Infection that gets trapped up under the gum line can lead to heart disease, kidney disease, and other internal problems. Not to mention that a broken tooth can be painful. So looking in your dog's mouth, examining the teeth, extremely important. And we've got a special case for you today. You're going to find it very, very interesting. Kitties, they don't have as many teeth. Kitties have 36 teeth, and in a normal mouth, they're shaped a little bit differently, and we run into similar but also some unusual problems in cats' teeth that we don't encounter in dogs. So today we're going to focus on dogs. We're going to focus on dental health. We're going to show you a patient that came to us from our friends at the Canine Stray Rescue, a sweet little dog that has some special dental issues. We're going to examine her, then we're going to anesthetize her. We're going to take you through the entire evaluation, cleaning, and treatment process so you see it from start to finish. And if we have time, we got two other visits that we want to do, exciting here as well. One is an adoption from our friends at Heavenly Paws, a forever home for this little dog. We'll see if we can fit that in. Last but not least, we've got an unusual situation, a strange accident but with a very happy outcome, something we want to share with you, so you'll be careful. So don't move away, sit there tight in your chairs and watch as we talk all about animals. Well, this is our patient today. This lovely dog is named Willow. She's a 6-year-old Doberman Pinscher, and again, she came to us from our friends at Canine Stray Rescue. And before they adopt out their dogs, they want to make sure they're in the best health possible. So they brought her in for examination, and as we looked her over, we found a number of small things. We're going to go through our examination again to show you what's important. Extremely important, though, is their teeth. And if we look inside her mouth, we see a fair amount of gingival recession, or gums are receding back here on the fourth upper premolar tooth, a lot of tartar buildup. We're not worried about discoloration. What we're worried about is good dental health. And so we need to address that. We need to make sure that fourth upper premolar tooth, that major grinding tooth, is healthy. And we're going to do that by probing and then by taking some x-rays. But we also want to check her over in general. So we're going to do that right now. Debbie, you want to hold on to her head for me? Willow, dear, look at me. There's a little growth on her eyelid. And part of the examination prior to having her dentistry done is to identify things that we can accomplish under anesthetic. We may want to take that little growth off her eyelid just to be sure that she only undergoes one anesthetic procedure. Put your head down, sweetheart. These stray dogs come with a story, but they can't tell it. We have to figure it out. And you look at Willow and you look at the crinkly ears and you just have to wonder, what happened? Was there some injury or something that happened to these ears to cause that? Did someone try to bandage them or do something to it? They don't hurt, they're not painful, but they're not what they should be. We'll check her glands. That's good. Debbie, you move to the front, I'll move to the rear. Good girl. Move that arm. Down here on her chest, we found a tumor, and we're going to evaluate this tumor, make sure it's not serious. We'll aspirate some cells out of it. I do need to listen to her heart and lungs again. We did pick up a heart murmur on our earlier examination, and it's still present. It's very small, very subtle. I don't think it's serious, but we're going to take some chest x-rays just to make sure. That emphasizes the importance of a pre-anesthetic exam. You never want to take a chance. So we'll be sure that that all's well with our little Willow, and then we'll proceed. We've got an anesthetic plan. We've got our dental equipment all ready. We're going to take good care of this little girl, so let's get going. So because we heard that subtle little heart murmur, we took chest x-rays just as a precaution. Chest x-rays are one of many methods we use to evaluate the heart. We're looking at the size and shape of the heart inside the chest cavity, and her heart size and shape looks very good with respect to her body size. We don't see any pathology. She's heartworm negative, but Dobermans are a breed that's recognized for having certain cardiac diseases. This will not impair our efforts today. We can go ahead with her anesthetic and her dentistry, and then we can follow up on her heart as she gets older, but she should be just fine today. So what we're doing is giving her her general anesthetic. We've done an intravenous, and now as she relaxes, Willow should relax her mouth a little bit. We're going to grasp her tongue, stretch that out. We have to maintain a patent airway. So there we go, sweetheart. We've just intubated her, and now we're going to place her on her inhalant anesthetic. I'll kind of reach across you here. And you can hear that sound. She's kind of breathing around that tube. So we need to inflate the cuff, which we'll do. You'll hear a change in the breathing. There we go. So now she's not breathing around the tube, but through the tube. And we've got it inflated. And we'll give her a few minutes for her to breathe this in and to relax, and then we'll put our monitoring devices on her. You're all set, Shauna. Thank you. So while she breathes in her anesthetic, I'll prepare her monitor. How are we doing, Deb?
Okay, we're a little excited at the moment, but we're okay.
Okay. So with Willow anesthetized, we're going to make sure she's stable, adjust our anesthetic levels, and get our monitors in place. We use several types of monitors. Right now, Debbie's hooking up an EKG monitor on her. We also have a monitor here, which I'll turn around so you can see. This is her pulse oximetry, and what it tells us is her heart rate, the level of oxygen in her blood, and her expired CO2. So we use that along with a lot of common sense. These are just machines, and sometimes the machines will give you funny results. So you always correlate that with what you're seeing with your patient, and that's why we have licensed veterinary technicians. Both of these individuals, Debbie and Rachel, actually were my students when I taught at the Macomb program, and I'm very proud to have them here. They were some of my top students, and I'm very pleased that they're here. They're very capable of helping me with this dental procedure. In fact, they're the ones that do most of the cleaning. They're very meticulous, attention to detail, and they're going to get Willow's teeth just where they should be. But first, while she's anesthetized, we're going to review some of our dental instruments, how we're going to use them in the mouth, and what we're going to do to evaluate her teeth. So give us a minute more to get her all covered up, warm, and snug as a bug in a rug. Make sure our IV's going, and then we'll start up with the dental instruments. So now what we're going to do is review our dental hand instruments and what we're going to use to work inside Willow's mouth. These are all carefully cleaned and sterilized between patients. And of course, they also are, especially with our scalers, need to be extremely sharp. So let's take a scaler that we're not going to use today and check it for sharpness. We use a tool like this, and what we're looking for is the ability of the cutting edge of this scaler to leave a mark or to elevate this plastic structure. And that's one of the testing tools that we have. We also have small little sharpening tools, and we have power tools that we can use. They have to be extremely sharp, just like in people. But we'll start off with a probe. And our probe has graduated depths. And our goal here then is to go under the gum line and measure the depth of the pocket that's present. And we can chart this just as we do in people. I'll leave that to my technicians, but I want to illustrate how important it is. And look at how far this probe can go up inside this tooth. And that's where the bacteria, that's where the disease is, in this area here. And that's what we're going to focus on. This discoloration in calculus is important, but it's not where our problem lies. So each of these teeth have to be evaluated. Look at the depth that this probe advances to on this lower canine tooth. Let me take that out and set it down. That's a very deep pocket, an area where hair and debris, food can accumulate, bacteria can grow, and infection takes place. Of course, a lot of our concern centers on this tooth right here. This is the fourth upper premolar tooth. It's a major grinding tooth in the mouth, and look at the amount of gum recession we have. This gum should come down to this level right here, and it's all the way up. So what we need to do is probe and then see, are we going to the root tip? Is this tooth viable? Are we going to lose this tooth in the future? And we need to know how much bone is around that tooth. So probing is helpful, and probing makes me suspicious that this tooth could be a problem for this dog in the near future. So our next step then will be to x-ray. Later on, what you'll see is the use of a scaler, and we'll use hand scalers and root planers to get up under the gum line and to clean these teeth out. I'll leave that to my technicians, but these are our hand instruments and very important to proper dental care. Okay, so we've set up for our dental x-rays, and we don't have a lead screen, we just have to maintain a distance, but we're going to go ahead and take our film here, and as you can see, we've got digital dental x-ray. So let's take our film and see what we get. Let's see if we'll charge this up right here. So we've done our x-rays, and this is a complicated tooth. It actually has 3 roots. And when you try to x-ray one root, many times it occludes or covers the other root. So we've gone through a series of films to look at it from all sides. And what we see is that both of these fourth upper premolar teeth are intact. They are viable teeth. We've just got heavy gum recession, some bone recession, but we think we can save them. We're going to try to do that. So we're going to move on with our dental procedure, and we're going to show you some of the cleaning process that we're going to go through to take care of her mouth.
The American Legion. We're a powerful force for the nation. We're the largest veteran service organization in the nation, with 2.5 million members. And when you add to that the American Legion Auxiliary and the Sons of the American Legion, we have a family of 4 million members, working hard every day for our veterans, our youth, and our communities. Go to legion.org to find out more about the American Legion's commitment of service to America.
So now what we see is the preliminary stages of cleaning. Debbie's using a special tool, an ultrasonic scaler, handpiece. And Debbie, will you show us that handpiece? So what we have is a metal tip, and if she steps on the pedal, you'll see that a jet of water comes out, and that tip vibrates very rapidly. It's a piezoelectric effect, where ceramics under pressure will produce electricity, but when you apply electricity, it changes their shape. And so then that causes this extremely rapid vibration, and it shatters this material right off the tooth. Go ahead, Deb, place that on the tooth. We're careful not to use the point, and let's see if I can interject here for a second. Debbie, I'm going to step in here because your hand's right in the way. And although I don't have gloves on, I hope that you can now see the tip. And Debbie, go ahead and step on that for a moment for us. And so we do it from the side. Whoop. Here we go. It would, of course, be when the doctor handles the instrument that everything goes like that, but that's okay. Go ahead, Deb, give us that again. And so we do it from the side. Some of this is staining, but we can work our way up and we can break loose this tartar. You'll see a dramatic change. It's a slow process, so I'm going to turn it back over to Debbie, and she's going to clean these teeth. This is stage 1. So Debbie spent a great deal of time cleaning the mouth with the ultrasonic scaler. But again, this is just phase one. This is the exterior cosmetic portion. So let's take a look at this mouth. Dramatic difference. All that tartar and calculus is gone. But now we have to get to the important part. We've got to work underneath that gum line, get all that trapped infection out, make sure we have no pockets. Debbie, can you show us that hand scaler and how you're going to use it? So that's an instrument I showed you a little earlier, and I said it has to be very sharp, and it follows the contour of the tooth, and she can either root plane or scale. She'll get up underneath there and make sure that's smooth as glass. And she'll do that on all facets of each tooth, and it's a tedious process. And with all the teeth that a dog has and the angles that are present, it can take a great deal of time. So when you consider a dental procedure or a dental prophylaxis on your dog, and you hear about keeping the dog awake and breaking and cracking the tartar off, this is where the difference occurs. You could never do this and do it properly on an animal unless it's anesthetized. This is how a dentistry is to be done if you're going to impact and benefit the dog's dental and overall health. So we're going to turn Debbie loose and let her work on this. After she finishes this up, and let me also point out, you notice a fair amount of gum bleeding. That's because those gums are inflamed. That's evidence that we've got dental disease present. But when she's completed with this, we'll do our last phase, which will be the polishing. But Deb, you go ahead and finish this up, and we'll come back and visit with you when it's time to polish.
Okay.
So after your pet has had a professional cleaning, even before that, what can you do at home to keep the teeth in tip-top shape? Well, remember, the plaque and tartar on the teeth takes time to harden. It starts off as this soft material, and then within 24 to 48 hours, it will harden on the surface of the tooth. At that point, it's very hard to remove. So ideally, you would brush your pet's teeth every day. We do it. Doesn't it make sense to do it for our pets? Molly just had her teeth cleaned. You remember my little Molly? This is my little Detroit street dog. She's a little shy today, and I'll be gentle with her, but I'll show you that her teeth are nice and white, just like Willow's, and they've been cleaned. Now, to keep them this way, I want to clean her teeth every day. We like to show our clients that it can be as simple as taking a gauze pad, opening it up, and making a little finger brush. The gauze is just abrasive enough that it can collect that material and wipe it off, and we just work on this outside surface of the tooth. And all around the mouth we go. Now, you do want to acclimate your dog to this.
Good girl.
I'm sorry.
It's okay.
Can you cut that part out?
Mm-hmm.
Okay. And so the gauze is very good to use. You can also, some dogs are very adept at having you put a finger toothbrush on, and it's got little bristles, and you can work in the mouth. And back and forth you go. And it protects your finger. Again, acclimate your dog. Get them used to having their mouth handled from the outside, the gums lifted, examine and look inside. But what about toothpaste? We use it, and dogs can too. But our paste contain detergents, and those detergents, if swallowed, can be upsetting to the stomach and the gastrointestinal tract. So we will use a veterinary toothpaste. A lot of paste in the pet store. You can certainly shop around. They have different flavors, poultry, beef. This is an enzymatic paste that we use here. We also will use a chlorhexidine paste as an antibiotic or an antiseptic. The enzymatic's nice though because it gets up under the gum line, and it's poultry flavored, and it comes in a little tube just like our paste does. And you open it up and you put a small amount either on the gauze or on the finger brush and the bristles and work that in the mouth. And then you can let them swallow this or take a drink of water, and a lot of it will rinse out. So that's very important. Your veterinarian may also prescribe a mouth rinse. This is a CET, chlorhexidine rinse. Very similar to something we might use. That bad breath in your dog can be controlled by cleaning and then prophylaxis and then a good home care, and this would be an important part of it. But that, of course, leads us to what we all assume is the ultimate answer, and that's milk bones. They've done a wonderful job at advertising, and isn't it as simple as giving your dog a treat to control dental disease? Well, no, it isn't. But we do have things like greenies, which is a a veterinary approved dental treat, and it helps to some degree. But the idea is that your dog will bite into this and it will crack and break the tartar off. Oh, you smell that, don't you? Yeah, that's one of your favorites. And it has some benefit, but nothing replaces the home dental care. You may also want to use rawhides, but if you do, you may look for a veterinary rawhide. You're not going to worry about the source on this and contamination issues. And this is a CET rawhide. A study at Cornell Veterinary School showed that flat rawhides, when chewed, can help to improve dental health. It works some of that material out of the pockets as we showed you. So good dental care begins with a dental examination by your veterinarian, counseling on home dental care so that you know how to lift the gums, look inside the mouth, and getting yourself comfortable with it, and then regular cleaning at home once a day. Start with puppies. That of course is the easiest way, but if you have an adult dog, well, you can do it then too. We'll be glad to talk to you about it. But at the very least, if you've got your pet at home right now and you've watched and paid attention to what we're doing, I want you to do this simple little exercise. I want you to call your dog over to you, lift up the gum line, put your nose down there and smell. And if it's not pleasant or if it looks red and inflamed, call your veterinarian today. Get in and have a discussion about dental health care. February may be Dental Health Awareness Month, but every day, every month of the year is important to dental care for our dogs. Okay, so to recap, Debbie's been working on Willow's teeth and she has scaled them with the ultrasonic scaler and hand scaled them. And these teeth needed a lot of attention. She's worked up under the roots and in those pockets and cleaned them and flushed them all out. And this has taken a half an hour for one side of the mouth. Now she's polishing, and the polishing smooths off all these rough edges so it's harder for the calculus to accumulate and hold on. So let's take a look at the polishing process. She's using a low-speed handpiece, air-driven, with a pumice or a polishing paste. That's a flavored paste, but the dogs don't care because we rinse it out of their mouth, but it's kind of interesting. That's bubblegum flavor. So Debbie, go ahead and proceed with the polishing. You've got the little rubber cup. We've all experienced this at the dentist. We know how important it is. And so we move along that gum, or along that enamel surface, and we polish away. So Debbie's going to polish each and every one of these teeth, and then we're going to finish up with a fluoride application. And with that, we'll be all done with this dental prophylaxis, at least on this side, and then we'll let Debbie finish up on the other side. So Willow's mouth is so much better than it was, as you saw, and we're going to talk to these folks about home dental care. In fact, I think we're going to share with you today how to take care of teeth at home after you've had a professional cleaning like this. Well, that was an exciting half hour. Time just kind of flew by. We covered a lot of territory. You should all know that Willow's up and awake and doing just fine. Her teeth are clean. She feels so much better. Rachel's got her new pet. So happy to have that little Edith in her home. But I kind of want to recap so you think about what we did today. And your take-home message is to look in your pet's mouth. Dental disease is ongoing, and you have to lift up the gums. You have to put your nose down there. You have to check things out. If you're not comfortable doing that, come on in. We'll be glad to help you. And we kind of brushed by our kitties pretty quickly. I said that cats are not small dogs, and their dental disease is different. And I'd like to point out that kitty teeth are sharp. You have to be very careful. They can puncture the skin. But kitties are prone to dental disease. And we lift up that gum line if we see any areas of redness along the gum surface or that plaque. minor changes can mean significant changes to the kitty. And so we'll gently rub across that gum surface. Don't be surprised if you see the head flinch or pull back, because kitties are prone to cavities right along the gum line. Very painful. They can't tell you it's there. They'll still eat. They'll just eat on the other side of the mouth. So for our little feline friends, please check their mouth. And if you're not comfortable doing that, come on in. Again, we'll help you. So we learned about the importance of dental care. We learned about what should be done in the clinic, what should be done at home, how to take care of them. Counting on you to take care of our lovely furry little friends, and look forward to seeing you next time on All About Animals.
President Roosevelt signed the Bill of Rights.
I've always appreciated the American Legion's
My gratitude to the American Legion.
Thank you all to the American Legion.
We have millions of veterans that are members of our organization. Thank you.
The American Legion. We serve America and its veterans. We pledge ourselves to our veterans, our youth, a strong national defense, and Americanism. These 4 pillars shape our work and what we do for America. There is power in our numbers. We're the largest organization of wartime veterans in the nation. We are 2.5 million members strong, men and women from every state in the nation and around the world. No other veterans organization wields this kind of power. We work relentlessly within our 4 pillars of service, and we succeed. The American Legion takes care of our fellow veterans and their families. We maintain close ties with Congress and the leaders in Washington, D.C. They respect us. They listen to us. We sponsor research and press for medical care and benefits for all veterans and active duty service members, whether they are members of the American Legion or not.
President Roosevelt signs G.I. Joe's Bill of Rights.
You've heard of the GI Bill of Rights, one of the most important pieces of social legislation of the 20th century. It was written and passed largely through the efforts of the American Legion. We were instrumental in the formation of what is now the Department of Veterans Affairs to make sure our veterans get the care and benefits they are promised and deserve. The young people of our nation are our future. They benefit from exceptional programs and generous scholarships that only the American Legion offers. We provide athletic programs like American Legion Junior Shooting Sports, Legion Baseball, and educational and civics programs like the Oratorical Scholarship Contest and Boys State and Boys Nation.
As Supreme Court Justice Hugo Black stated, the quality of justice that Americans receive should not depend upon the amount of money they have.
We promote citizenship and an appreciation of government. We have all been directly involved in our nation's defense as wartime veterans. We know what policies, tools, and manpower our military needs to protect this great country. We fight to get these things done.
We're all very grateful to have the American Legion on point.
We take our case all the way to the top in Washington, D.C. to ensure that America is prepared for any threat. We are patriots through and through. We believe in our flag and all that it stands for. Our Constitution, our Pledge of Allegiance, our way of life are all fundamental to maintaining our freedom and the standing that we have as the greatest country on earth. We promote and defend these values every day in communities across the nation. These pillars represent not just what we do, but who we are. We're here to serve our fellow veterans, their families, and all of America. We are here for them. We are here for you. The American Legion asks you to join us in our mission. If you share our vision and commitment to America, visit our website at legion.org or your nearest American Legion post today.